Okay, welcome to this class on, it's basically on treating venomous bites and stings, but particularly there's one particular spider that we're going to talk about, and it's obviously here in the title, Brown Recluse and Other Venomous Bites. And you'll see as we get into this why I've included other creatures in this. Before we start, though, I want to share this disclaimer. I encourage you to do your own research. You can read through this. Nothing covered in this video is to be construed as diagnosis, prescription, or treatment of disease, because God is responsible for the results of obedience to his lifestyle plan. The receiver or user of this, I got an extra word in there, of this plan and information must personally assume all risk for the use or misuse of the information in this document. Therefore, this disclaimer serves as notice to the receiver that he or she is free to seek medical attention, advice, treatment, and diagnosis from a licensed medical professional. My second disclaimer is to give you a fair warning notice that there's some pretty graphic pictures in this, and I chose some pretty graphic pictures because I want the point that I want to make is that when we're dealing with these types of venomous bites, stings, and stuff, there is a level of urgency, and we have to really know our stuff. We have to know how and how quickly we need to treat these things. And so I wanted to share some graphic pictures so that you can see what can happen if they are not addressed with dispatch, as soon as they're needed. Let me put my glasses on so I can see what I've got here. I'm kind of going to tell you what I'm going to tell you, and then I'm going to tell you, and then I'm going to tell you what I told you. And the reason I'm doing this with this particular aspect of this talk is because I really feel like it is very important to understand why we also include the use of herbs. We'll talk about that a little bit later, along with the use of charcoal when we're dealing with these injuries. The brown recluse is not alone. There is in the brown recluse venom, as well as the hobo spider and the pit vipers here in the United States. I'm speaking specifically of these insects and vipers that are in the United States, because I don't know in every country what is available, and there may be people from all over that are watching this, and I encourage you to do some research on that. There is a factor, it's called a spreading factor, and it's an enzyme called hyaluronidase. It's kind of hard to say, that is in the venoms of these creatures. Hyaluronic acid is, you can see here, it was known until the 70s as the goo factor. It is vital in skin lubrication and also cartilage repair, and it's like the glue that kind of holds our cells together. That's hyaluronic acid that is naturally in our bodies. The enzyme that is in these venoms is hyaluronidase, which is, you can read it here along with me. It's an enzyme found in the venom of some arachnids and pit vipers and is known as a spreading factor. And and it aids in the breakdown of hyaluronic acid. So we saw there that the hyaluronic acid is kind of like glue that holds our cells together. The hyaluronidase breaks that apart and allows venom to spread. The next two slides are also about this. So I want to drive this point home. Here is a link that you can follow that describes this more carefully. That's a picture of a brown recluse. We'll talk about that more in just a minute, but that'll give you an idea of the size of a typical adult brown recluse spider. That's a quarter there. And you can see he's at least as big as that quarter. Hyaluronidase is one of the enzymes present in venoms of snakes, leeches, scorpions, bees, caterpillars, spiders, and many others, which acts as a spreading factor and can cause local tissue damage like destruction of extracellular matrix and connective tissues. Here's another one. This is a link that I would encourage you, particularly if you are a medical professional, healthcare professional, whether it's nurse, clinical herbalist, doctor, whatever. I encourage you to go to this link because it's got some really good information on it. Venom hyaluronidases are always referred to as spreading factors, as they hydrolyze or basically destroy, break apart the hyaluronic acid present in the interstitial matrix, thus helping the venom toxins to reach the victim's bloodstream and invade its organism. Hyaluronidase's enzymatic action increases membrane absorbency, reduces viscosity, and makes tissues more permeable to injected fluids. That's a spreading effect. And therefore, it acts as a catalyst for systemic envenoming. So it's like, let's look at this picture. This spreading factor, if you think of hyaluronic acid as kind of like, you've probably all played with Legos. And the little bumps where the Legos snap together would be like the hyaluronic acid. And if you cut off all those bumps so that you couldn't snap those pieces together, they could be easily scattered and separated. That's what hyaluronidase does. It actually kind of almost dissolves your tissues so that the venom can spread. Okay. Now, elapids, which is like I think the cobra is also an elapid, and there's others, but the one that we have here in the United States is the coral snake. Their venom contains no spreading factor. It's a different type of venom. So this poisonous snake, we have 4 poisonous snakes in North America, and that's this one here, which is the coral snake, and then these 3, which are the copperhead. You can see how difficult this guy right here would be to see on the forest floor. I have probably walked past many of these, but I'm very careful, and I often take a walking stick with me into the woods, but none of them are actually easy to see in their natural environment. The water moccasin is the next one, and then the rattlesnake also has this spreading factor. Here comes a graphic picture. If you're squeamish, you might want to look away, but this next picture I'm going to show you was from a rattlesnake injury. And that's the extent of tissue damage that can be done. This has been debrided and prepared for surgical repair. So, this is not something to be played with. We really need to know what we're doing when we're dealing with these things. Okay, this is a picture of the brown recluse, and you'll notice here on his back, the nickname of this spider, of course, is the fiddleback, because of the fiddle shape here. Another unique feature of the brown recluse is that he has 3 sets of 2 eyes. Right here you can see 3 sets of 2 eyes, and most spiders have 8 eyes. So here's another picture of the hobo spider. That I know of, I've never seen one of these. I'm sure they're probably in our area, but we've been more attuned to the brown recluse because they're more common in our area. This spider is more venomous. I mean, he'll fight a buzzsaw. More aggressive. So he's not one to be played with. We also have the black widow spider, which is extremely venomous, but his venom does not have, or her venom does not have, that spreading factor, even though her venom is very toxic. But we're going to focus, as I said, on the brown recluse. It's more commonly located in the southern states, like from Texas eastward into Georgia, and probably some even in the Carolinas. And then as far north as like Ohio, Arkansas, Missouri, the southern plains states. It can be found in other states, especially due to the shipping and trucking industry. Unlike other spiders, I mentioned this before, they only have 6 eyes, and they have the fiddle shape, and they like to live in dry, dark places like attics, boxes in your closet, boxes under your bed, those types of things. Most of the people that are bitten by brown recluse are bitten indoors. The venom damages tissue cells and destroys blood vessels and blood cells, and we'll see that more about that in just a minute. Mortality is rare from a brown recluse bite, but it has happened. But limb loss and massive tissue damage is not rare with these bites when it's treated medically. And I'm going to share 2 personal experiences with treating brown recluse in just a little bit. Okay, here's something. I thought this was very interesting because there are key features to look for when you suspect a brown recluse bite. And this is a mnemonic. It kind of eliminates the possibility of your injury or your bite, if you have somebody come to you, or if you yourself have a bite and you think it might be a brown recluse, go through these things. You can take a screenshot. This hopefully will be on YouTube later, so that you can go back and look at this. But it's numerous is the first one. The N. Only one bite is present with the brown recluse bite. Occurrence: a bite usually occurs when disturbing the spider. They're very reclusive. Timing: most bites occur between April and October. That's pretty accurate. R is red center. Characteristic bites will have a pale central area. I'm going to show you some pictures in a few minutes, and you'll notice this. And then elevated: if the bites are, usually the bites are flat. If it's a big old bump, then it's probably not brown recluse. C, chronic: these bites usually heal within 3 months. L, large: these bites are usually not, the central bite area itself, it's not that large. U, if it ulcerates very early, it's probably not a brown recluse. Usually they don't ulcerate until about day 7. I have seen them ulcerate a day or so earlier, but that's typical. S, swollen: they don't tend to swell that much initially unless they're on an extremity. E, exudative: brown recluse bites do not cause exudative lesions. And then we're going to look at some more pictures here. Okay, this is a brown recluse. I think this is day 3 right here. You can see this picture. I don't know what happened here, but it's covered up somewhat, but you can kind of see at the top there. This is day 5. You can see over here on this side, this is the same injury. Day 3, day 6, and by day 9, this is with standard medical intervention right here. You can see massive tissue loss, and he may lose control or use of his thumb. He may actually lose that. But you can note here the opaque, right here, the capillary bed is destroyed. That's why you have this opaque whitish appearance. So you can kind of look for some keynote features here. This is a bite from a college student, and as a result of this bite, they were handed a bill. Here's the link for that, for $1 million after this bite. $1 million. Here is what can happen if you allow a brown recluse bite to go untreated a little too long. It's not a plaything. These are things that really need to be addressed aggressively. Here's another one. You can see massive tissue damage here, and that really, in my personal and professional opinion, does not need to happen. I don't believe this needs to happen. You can see from the previous and some following pictures that I'm going to show you just in a minute that we really need to learn to act intelligently and in an educated manner with urgency to prevent the kind of tissue damage that we saw. And recently on a Facebook page that I'm a member of, a lady reached out. Her husband had been bitten by it was a known brown recluse bite. Before I go into that and share the photographs, I'm going to share a personal experience that I had when I worked at a trauma clinic here in Alabama many years ago. I was in my probably mid-20s. That's been a long time ago. And I worked at a paper mill down in Cottonton, Alabama. They were doing an expansion, and we had literally thousands of construction workers that came in from all over the place to help build this thing. And they were staying in some pretty shady places. They were just staying anywhere they could find a room, because Cottonton is just a little hole in wall town. And this man came in the clinic one day, and he had a bite on his hand, and he said, "I think I got bit by a spider." And he thought it had been maybe 3 or 4 days ago. And it looked like similar to some of these early photographs, maybe the photograph that we saw on the thumb. And we had a physician working with us on staff, and I called him in. He looked at it, and he said, "Yeah, I'm pretty sure that's a brown recluse." Well, they gave him some Keflex and sent the man home to Florida, where he was from, to see his surgeon, because he was 100% sure he was going to lose a lot of tissue from that bite. After the doctor left, I did something that I could have really gotten in trouble for. I asked the man if he was willing to do something different. And he was very open to that. He was not interested in losing, a good part of his hand, and his bite was on his hand. So I called some friends of mine at UT Pines Institute, which is the medical missionary training institution here in Alabama. And I said, I'm going to send this guy. Can you fix him up with some charcoal? And they got everything ready. I told the man what to do, sent him away. And I didn't see him for about 2 months. And finally, he came back in the clinic for something totally unrelated. And he had a little purple scar on his hand where the thing had healed. And I asked him what happened. And he said, well, I did what those people told me with the charcoal. And I went to my surgeon and he said, you don't need me. Go home and keep doing what you're doing. So I was very pleased with that. And I want to show you now what just happened. I think it was April 2nd. I think I have that in one of the pictures, the actual date that I contacted this lady. This is a case study that just happened, as I said, from a known brown recluse spider bite. I want to point out several things here. You can see the black on there. The lady had used charcoal poultice, and she took the poultice off and took this picture because she was alarmed. She's also a nurse, so she kind of knows what she's doing. She worked in critical care, which is what I did when I was nursing for the most part. This was, again, a known bite. They did not get up during the night to change the poultices. They just put a poultice on in the evening, and that was, it until the morning. If you look very carefully from the center of the bite going up towards the knee, you can see a red streak. And if you don't know what that is, that's lymphangitis. That means he's in deep trouble. He's got infection going on there. If he had gone to the hospital, he probably would have at least been given IM and probably IV antibiotics for that. He may have been admitted at this juncture. I think he probably would have been. This is a little bit close-up picture. You can see already where the bite was actually occurred is starting to become opaque, and the redness and the swelling. It's the classic appearance. And then this was whenever I actually first saw it I first saw the one with the charcoal. And then this is what she shared with us the next day. You can notice again here the red streak going up the leg. You see minimal swelling. If you see the sock line down here, you can see it's not terribly swollen. It is red. You can see the actual bite spot, and you can see the red streak going up his leg. Now, I contacted this lady privately. I saw her post on the Facebook page, and she had gotten a lot of answers. And I'll address that more in just a minute. And some of the answers had good suggestions, but I contacted her privately, and I don't think I was pushy, but I was pretty much encouraging her to do the treatment that I'm going to talk to you about in just a minute. And it took me some time to convince her to do it because she had received so many different answers that she was confused and perplexed. She was exhausted. She didn't know what to do. And so after she did the treatment, she went from this to this in one treatment. And I'll tell you in just a little bit what we did. But can you see the difference? Somebody unmute, please, and tell me, can you see a difference? There's a major difference.
Yes,
there.
definitely.
Inflammation's way down.
Yes, it is. And you still see the red streaking, but this is only one treatment. Okay.
Yes.
So this is, usually you don't see regression in a brown recluse spider bite. You see a continuation of this spreading, this tissue destruction, and all this, but that's not what you see here. Okay. After 2 days treatment, no, the red streak is completely gone. The redness in general is markedly reduced.
Wow.
And this is on day 3 of the treatments. This is a extremely successful treatment. So you can see a big difference. So we did totally different treatments and we had totally different outcomes. This was the standard medical route. And this was with our little natural remedies in 5-gallon buckets. So what did we do? Okay, I wish I had the opportunity to take pictures of the actual treatments, but this lady, I was coaching her over the internet on what to do. We were back and forth, and I was telling her, how to do the treatments and stuff. So here's what we did. There are herbs that contain, remember we talked about hyaluronidase at the beginning. Hyaluronidase is that spreading factor. There are herbs that contain hyaluronidase inhibitors, so they block that spreading factor. And there's some very common herbs on this list: echinacea, turmeric, rosemary, plantain. In fact, my clinical herbalism instructor, Dr. Patrick Jones, knows of a friend of his had gone out into the desert hiking, and he was way out in the boondocks by himself. I guess you don't call deserts boondocks, but anyway, he was out in the wilderness by himself, and he got bitten by a rattlesnake. But there was a river down from the mountains where he was, and he went down by the river, and because he had no cell phone, and he knew if he tried to make it out, he probably would perish. So he went down by the river because he had seen lots of plantain down there, and he just ate plantain, and he chewed up and made plantain poultices and put on that snake bite. And within about 24 hours, he was able to leave and make his way back out. So he just spent the whole day eating plantain. That's all he ate, was plantain and drank water. Lemon balm also has the hyaluronidase inhibitors, as does ashwagandha. And there are others. I didn't have time to research a lot of the others, but the ones that I used with this lady were echinacea and turmeric and plantain, because that's what she had on hand. That's why it's important to know a variety of these herbs that have these factors, so that if you're dealing with somebody in a situation like this, okay, do you have any of these? Okay, you have that one, we'll use that one. So it's very important to know the factors that these herbs contain. So what we did a very aggressive hot and cold contrast. We took a 5-gallon, I had her take a 5-gallon bucket. You can read along here with me. Fill it as full as possible with water as hot as he could safely tolerate. And to that bucket, I had her add a 1/2 to 3/4 cup of activated charcoal powder. She had enough charcoal for 1 or 2 treatments, and she had to go borrow some. Okay, so again, you need to have enough stuff on hand. We're coming into some rough times. So if you don't have a good supply of these things, now's the time. So we had that bucket, 5-gallon bucket. We filled it with the hot water, put the charcoal in that. And then we had a second 5-gallon bucket that we filled with cold water, very, very cold, even with a couple of ice cubes. You want a very aggressive, very brisk reflex reaction between this hot and cold. Okay, the charcoal is going to help to pull some of the venom, and I don't know, but I believe that it still would pull some of that hyaluronidase out as well. We were aggressive with this. I had them do the treatments a minimum of 4 times a day. They went back and forth 5 to 7 times. And again, we did that treatment 4 or 5 times a day. And I would even do it more times than that. In between, they used these poultices with these herbs. They had on hand echinacea, turmeric, and plantain. They had harvested and frozen some plantain from their yard. They had dried it and they had it in the freezer. So everything that he drank, and I think that's on the next slide. Yeah, teas of echinacea and turmeric were given internally, and plantain as well, tea. Everything that he drank for the first 24 hours had to be a tea from one of these herbs, because we didn't know how much of that spreading factor had gotten deeper into his tissues. And so we wanted to give it internally as well as topically. So we were doing hot and cold contrast 4 times a day at least. And then we were doing, once you finish with the contrast, you give the skin some time to air out and dry. And then you put a poultice, and overnight put a poultice, because these folks were exhausted. They needed to sleep at night. So I just had them put this poultice on at night, make some extras before they went to bed. And if they got up to go to the bathroom, change the poultice. Okay, that's why I had them be so aggressive in the day, because the wife herself was having some health issues and recently had some heart surgery. So she didn't have, a lot of reserves left. So I had to be I had to think on my feet with how to have them do this. So this is basically the treatment that we did. You can see from the photographs that the recovery was rapid and marked. And I have also some links here to verify what we're talking about here. Let me point out something here about Marshmallow. If you have a bite that is, or any kind of wound really, that is kind of advanced and you're not sure that you may have some gangrene or some exudative tissue, some eschar that's going to develop, Marshmallow added to a wound powder and made into a poultice or packed directly into the wound, it will draw the line of demarcation between tissue that's going to live and tissue that is not going to live. Okay, so Marshmallow is always a really good one for any kind of injury like that. Now, this is my final slide, and I just am going to read this because this is why I did this Zoom class, and I appreciate all of you being here, and I am going to put this on the YouTube channel. What prompted me to do this class was the fact that the wife of the man that with the bite on his leg had reached out on a Facebook page geared toward natural remedies. She was given many, many suggestions that were not only incorrect, but due to the urgency of her situation, could have had devastating results. You see the level of tissue damage that can occur with these bites. She became confused and exhausted and wasn't sure how to help her husband. So much so that when I reached out to her privately, it took a while to convince her to actually do the treatments I was suggesting. It is my desire to encourage those who want and are striving to learn natural remedies, but in the learning process, we need to understand our limits and be willing to sit it out and just pray for people and learn instead of throwing out suggestions that could do more harm than good, even though we're well-intentioned. So that concludes the presentation. And again, if there's anything on here that you need to see again, I hope to have this uploaded sometime later this week to our YouTube channel. And I'd like to take just a few minutes for some questions. If anybody has questions or comments, I'm open to that. And then we'll wrap it up.
So let me just let one more person in. So yeah, if anybody has questions, feel free to unmute. I mean, have you seen these spiders before? Have you been close to nearly being bitten? Kevin, go ahead. Kevin has his hand up.
Can you tell me about the marshmallow again?
Well, marshmallow is one of those mucilaginous herbs. It's very good for wound care. And if you add it to any wound powder, that you can actually mix it like with honey or something and just pack it right into a wound, it will draw the line in the sand basically between tissue that is going. It can actually even Dr. Jones has even seen it stop the progression of tissue that's in the process of it's heading towards gangrene. And so it's a very helpful herb to use in wound powders. Does that answer your question?
Yes,
Okay.
Thank you very much.
Would you, Dana, explain a little bit what mucilaginous means? Not everybody knows what that means.
Okay, everybody knows what snot is, you know. I'll just use the layman's mucus. Yeah, that's mucus. So a plant that has properties it's slimy like that, think about slippery elm, aloe vera. They all have that gelatinous, slimy kind of texture. Marshmallow and Malva neglecta, which is another form of mallow, and I think it's hollyhocks are in the same family and can be used similarly. So they all have that mucilaginous property, that very slimy, very soothing to the mucous membranes and any wound tissue.
So it kind of like grabs the toxins and it helps flush it out.
Yeah, it's very detoxifying to a wound and very, very healing. Yeah, I like to mix it with other stuff too, like comfrey, you know, and turmeric.
Which comfrey is also pretty mucilaginous itself.
Right.
Sarah, thank you for your question. Wants to know how to make a poultice because she's never made one before. Should we refer to the charcoal comfrey poultice video?
Yes, if you go to my channel, there is a video. There actually, I think I have a couple of videos on making poultices. I have a presentation on activated charcoal, and I show how to make a poultice in there. And then I have a video on how to make charcoal comfrey poultice, which is a very good poultice. I think that's it. Anyway,
Yeah,
yes, there is a video. There's an entire video where I address that, how to make that. So
I'm
that
trying to
is,
find your channel. My internet's just a little slow, but I'll post it on the chat. So just subscribe to Dana's channel and you'll get
okay.
so much learning. I have learned so much. Dana's my teacher. I've learned so much from her. So please
Learn from one another.
use her knowledge to your advantage. God has provided. So let me
The channel is just under my name. If you can't find it, it's Dana Gazelshin. So
right, you can just search YouTube her name, or I just put a link there, and then under her
yeah.
channel you can search like charcoal or comfrey, and then you'll find the video. Cullen has his hand up.
What's that?
Your husband,
Just,
I think, has his hand up.
My
Just-
husband has.
yes, I have a question for you. How would you know when to cease doing the treatments?
I am going to share my screen again, and I want to show you one of the slides here. Can I share here? Okay.
Yep, I'm seeing it. Mhm.
Once this lady's husband got to this point, he wouldn't let her do anything anymore. He said, I'm done with that, you know. So, if your patient does that to you, then you're done. I probably would have continued at least the poultices for another couple days at least.
Yeah, me too.
But this looked pretty good, right here. I was satisfied with that, and he's fine. He did fine with that. So
Would it help if you showed the original photo where it's actually very inflamed versus this where the inflammation's died down quite a bit and it just looks a lot more stable? It doesn't look as active anymore. So
Right.
just that's
And you don't
all.
have the streaks. Yeah, the red
This is
streak, the red
inflamed.
meningitis. And I had this when I had the dog bite. I tell about the dog bite and the cat bite and all that stuff. And I did the hot and cold contrast. And I never got tetanus until I had a cat bite, and I didn't do that. And then I got tetanus.
So
So,
this is inflamed and the other photo would be
right.
stabilized. But nevertheless, I mean, I agree with Dana. I would go further for another like week doing something.
It's hard to nail guys down. And this guy is kind of like my husband, a contractor,
You know, my
carpenter,
husband does the same
handyman.
thing.
It's like, that thing's in my way. So anyway, but to end up with this as opposed to that, to me, is worth learning a little bit about herbs. So
For those who have just joined, actually, like a handful of people just joined, the photo, totally different treatments labeled, and the big hole on the person's thigh, that's surgically, or is it, that was neglected, right? This is a
yeah,
neglected photo.
yeah, they had to have that debrided because they didn't treat it with herbs and stuff. That's
And this
the only treatment that medicine knows is just cut out the dead tissue.
yeah, unfortunately.
It's sad,
And
because
this side is restored, like the body healed it with all of the remedies that Dana had advised the patient to do. So he kept his skin basically, and muscle tissue and everything. We have a question from Sarah also, if there are any natural remedies class that would be good to take.
Are there any natural remedy classes?
What do you recommend for natural remedies class? Sarah, it's her first time learning about poulticing, it seems like. So what would be a good place to start learning about natural remedies?
Well, you have some stuff posted on your page, and then I think Med Missionary teaches some remedies. I have a lot of stuff on our YouTube channel. There's other places like UG Pines that has things on their channel. They also have online training, UG Pines and Wildwood, and there's probably other medical missionary schools that have online training as well. I also would highly recommend, and if anybody wants to reach out to me, after the video here, you can email me at closureforjesus@yahoo.com. I would highly recommend taking a course in clinical herbalism, because the course that I'm taking with Dr. Patrick Jones, he teaches a lot about wound care. He's also a veterinarian. He's a naturopath, a veterinarian, and a master herbalist. So, I mean, the dude knows his stuff. And I have thoroughly enjoyed his class. And even though I'm a healthcare professional, I have learned a lot. I have learned a lot from him, even aside from the herbs, just dealing with wounds and disease processes and stuff. It's been very, very beneficial to me. And so if you message me at closureforjesus@yahoo.com, I can send you a link to his course.
Awesome. Yeah, it's really helpful to just gain that background exposure by just looking at all those free YouTube channels. Do consider donation for our missionaries who, have given up their careers for mission work entirely. But otherwise, these are all free for everybody to learn. My website is free for everybody. Just go and get exposure before you start to do anything. So before you implement it on somebody, unless it's really simple, like steeping tea leaves and things like that. And then look up some classes that, you need tuition for. That way you would absorb more when you take the classes because you've gotten so much visual exposure. That's something that I would recommend. Yeah, so don't stop researching just because there's no actual class. I don't have any more questions on the chat. Anybody else want to raise your hand or unmute and ask something for Dana? Anybody who just joined want to see a slide again, or?
I appreciate everybody coming, and I wanted to do it on this platform as well as on YouTube, because when you have the question and answer, sometimes things come up that I didn't cover, and it helps me to learn. I learn from you guys, how to cover stuff more thoroughly. So I appreciate the questions.
Well, Fran just mentioned that your plug for Dr. Patrick's herbalism course.
Yeah.
She was hesitant, but then now she's very encouraged to consider it highly. So praise
Yeah,
God.
it's well worth it. I'm not quite done yet, just because we've had a lot going on and stuff, but I'm hoping to finish that here in the next couple of months.